So Kathy, if you could just advance the slide, I'd like to just do a quick agenda before Jen gets going.
Oh, sure. Yep. Sorry about
Thanks.
that.
All right, so thank you again, everyone. We're thrilled to be back for year 2 of this Choose Safe Places project work. And so the meat of today's discussion is going to be hearing from our internal kind of funded partners. So first we're going to have ATSDR, Jen Freed, provide an update of what's been happening recently and just kind of share some brief updates of exciting progress. Then I'll be speaking on behalf of Children's Environmental Health Network and talking about, again, what's a recap of what we can offer through this project work and what are we excited to be offering you guys in this year 2. Then we're going to hear from Tiara from NACCHO, and then we're going to hear from Toby Bernstein of the Environmental Law Institute, and then we're going to hear specifically from 2 individuals representing Wisconsin and New York and some recent progress that they've had through their Choose Safe Places work. And then at the end, again, we'll be opening it up for discussion. So just to reiterate, if you have specific questions after each of the presenters, we're happy to have you ask those either through the chat box or by unmuting yourself after each presentation if it pertains to that. And with that, I'll hand it over to you, Jen. Thanks.
Hey, good afternoon. Can you hear me okay?
Yes, we can. Yep.
Okay. All right. I just have a few quick updates before we turn it over to our partners. I just wanted to welcome everybody back. It's been a little while since we had our last webinar, and I'm excited that we're able to begin these bi-monthly webinar series to you again. Just kind of as way of background, there may have been some new state staff in our state since our last update that we had with you all. I think our last update was in August. We had an all-state call, and we went over a lot of information there. We had a different ATSDR staff participate and talk about how year 1 went, what we were looking towards for year 2, kind of what the plans were. So if you missed that August call, we do have a bunch of notes and slides and lots of information from that call available if you need it. It's on our SharePoint site, and I'll actually go over where you can find that again in just a couple of slides. But so I just thought I'd reiterate a few things, some of which we covered in the August call, but we have some exciting things planned for our year 2, but really, you know, for you all, you're midway through your program, midway through the 3 years just about. So we're calling it year 2, but we recognize you're already well into your year 2. So really excited to have our partners back. I'm glad you'll be hearing from them again to make sure you know how they can help you. Some other things we have going on, working with the National Resource Council and CEHN to incorporate CSP into the Caring for Our Children document. Hester's going to mention more about that. We are together planning some conferences where we can talk about the work together. We have a journal article that will be published next year, the Journal of Environmental Health. It's just an overview of our Choose Safe Places program and some of the work that is happening in the States. That's going to be authored by Arthur Wendell in our Region 10 office. We are also working on some website improvements, our Choose Safe Places website. So we're looking at redesigning it a little bit, adding some resources. Some of our ATSDR CSP staff have talked with some of the states to get some ideas on what would be helpful. So we'll be working on that this year. And then in August, we also mentioned how we would be having state engagement calls with all of our states to sort of see what kind of support we could provide to you and go over your plans for year 2 and see you know, what we could do to assist you and what further resources you might need. So I'm happy to say that we're just about done with all of those state engagement calls. I think we just have a couple left, and we are planning to kind of summarize that information and see what we could share with you that would be helpful to you all. I got to participate in several of those calls, and it's really exciting to hear all the progress being made. I just wanted to also mention a little bit about our hurricane activities. I shared this also in August, but since then we've really gotten the work underway for the funding we received to help areas impacted by the 2017 hurricanes. One new piece of information since we met in August is that we now have our partners established for that hurricane work. We are partnering with the National Environmental Health Association, Region 2 Head Start Association, and the American Planning Association to do some of these products over the next 2 years. So what we're really doing here is we're trying to take what we know about Choose Safe Places in our current guidance and see how it can be used to help the hurricane impacted areas assess their ECEs. So we're planning a few products with that, supplement to the guidance manual that adds disaster recovery, environmental health issues in, a facility assessment checklist, a continuing education module for planners and zoners, and some rapid design forum tools. In addition, all of our Choose Safe Places materials will be translated to Spanish, and including our website, our full website. And just for your awareness, we are funding USCI, Puerto Rico, Texas, and Louisiana to work on Choose Safe Places related projects. I expect that some of these materials may be helpful to states going forward, so as things become available, we'll be sure to share with you all. I just wanted to also mention about SharePoint once again in case you haven't been able to use it yet or you haven't checked it out yet, but we do have a SharePoint site available specific to Choose Safe Places work. It's where all the other ATSDR SharePoint information lives, but there is a specific site. I've included the link here if you don't have it. It's a really great way to share resources and ideas with other states and to collaborate on some maybe common projects that you have or ideas that you have. There's also a place where ATSDR is sharing resources. So we have things there such as templates, fact sheet templates, our logos. We have meeting recordings from last year in there, notes from meetings. There's quite a bit of information in there right now. There's also a contact list for each state's Choose Safe Places contacts. If you haven't added your information there, I would like you to do that. It's in an Excel file on SharePoint. If you really don't want to use SharePoint, you could feel free to email it to me, and then I could pass your information along to make sure you get future meeting announcements. And if you haven't checked out the SharePoint site recently, I would like to encourage you to do so. It looks like I think about almost 10 states have shared resources at this point. And just my last slide, I just wanted to give everybody a heads up about the reporting requirements for year 2. Similar to last year, there will be some CSP specific reporting requirements. We'll be using the same forms as last year, the Excel file that you've all seen, and there will be a narrative component as well. The Excel file remains optional, but we hope it is convenient for you to use it. And we are preparing some FAQs, an example narrative, due dates, and some other guidance that's going to be shared by email in January.
Hi, Jen. This is Kathy, and I just there was one question for you. Disa wanted to know what the focus of the ATSDR journal article in the Journal of Environmental Health was.
Oh, yeah, thank you. It's really just an overview of the Choose Safe Places program. I believe Tara and one other colleague at ATSDR published something about Choose Safe Places when it was called Safe Siting, really several years ago. And so it's sort of a follow-up article about kind of where we are now, how it's working, and kind of the pilot program we've established with our state partners.
Great, thank you.
Did any of my ATSDR colleagues have anything to add?
And again, if you want to come off of mute, you can hit *7 to unmute yourself.
Okay. Well, thank you.
All right, can everyone hear me okay?
Yes, we can.
Great. So some of this will be redundant for those of you who were active in this work last year, but for those of you who are new, we know there's been some staff turnover. We wanted to reiterate, as we said, for these internal partners, kind of what our role is and how we're working within this realm of children's environmental health within early learning spaces. So my name is Hester Paul. I'm the National Director of Eco-Healthy Childcare, and this is a national program housed within the Children's Environmental Health Network. Next slide. So the mission of Children's Environmental Health Network, which is based in Washington, D.C., is kind of overall, I think about it as just protecting children's environmental health for young children. So there are 3 ways we go about this work. Ultimately, we want to be promoting preventative research. We do that in working with different pediatricians, researchers at universities, toxicologists. We want to use that information and distill it down to make it available and understandable to the layperson or anyone else. We want to take that information and turn it around to promote protective policies. And then we want to educate folks, again, taking the research, everything is research-based, and trying to relay what can we do alternatively that would improve the health and safety of all young children. One of our key programs within Children's Environmental Health Network is called the Eco-Healthy Childcare Program, and Kathy and I work together to run this program. So what we did in creating it back in, it was actually a combined program of 2 different groups. One was based in Oregon, which is why I'm located in Portland, Oregon, and the other one was based originally with Children's Environmental Health Network. But what we did in the beginning was just really identify that there was that information gap for early learning professionals, both family child care, Head Start, early Head Start, and center-based providers in understanding what is environmental health generally. We found that in doing kind of some outreach and surveying that people not only didn't understand what environmental health was, but they also weren't understanding children's specific vulnerabilities and routes of exposure. And so what that led to was us realizing not only is this information important, but knowing that there's not a lot of extra money within early learning facilities and within this profession, we need to be able to provide realistic and cost-effective strategies. So you're not just kind of depressing people and telling people what's concerning and challenging, but also turning that information around and giving them alternative solutions. So the ultimate goal of Eco-Healthy Childcare is to empower and support and educate early learning professionals to realize what they can do to make changes. Next slide. So one of the primary tools that we have here, kind of showcased on your right-hand side of your screen, is our checklist. This is a self-audit checklist that contains 30 items that are best practices within 12 different content categories. The idea is that people can self-opt to go through within a facility and try to comply with 24 of 30 best practices. 3 of them are required, but ultimately otherwise they have some flexibility to determine what they can comply with. The idea here is that we want to push them to basically do better with environmental health, because we know from looking at different state licensing regulations that the state licensing regulations don't comprehensively cover environmental health to the extent that's needed to really protect the health and well-being of young children. So that is one option for engagement for child care professionals. Otherwise, what we're offering, all 3 are different fact sheets, different really frequently asked questions. At this point, I think we're upwards of about 20 of them. So anytime we're getting questions from trainers or health consultants or licensing staff or direct service providers, if we don't already have a resource available, then we're taking into account what's needed and trying to create something. So recent examples might include helping people understand what kind of baby doll they should be getting and trying to avoid PVC baby dolls. Another example is trying to answer questions that they have about artificial turf. So again, we're always bettering the resources that we have and then also trying to generate new ones that are needed in the field. We very regularly are offering technical assistance. Sometimes that's done through in-training webinars, but often it's just through phone or email. We have a 5-hour Train the Trainer course that has been delivered thus far in 32 different states. We're going to talk about that in the next couple slides and how we're working with Colorado this year. We also have an e-learning course that many of you are familiar with from when we talked about it in year 1 of this project, but that e-learning course is ultimately the 5-hour course that's been distilled down to 3 different hours, and ultimately it's been recognized for adult learning clock hours in 48 different states. So it's a great option for child care professionals to learn more about environmental health and then also be earning the clock hours that they need for their state recognition. Finally, we are very much kind of guided by our Eco-Healthy Childcare National Advisory Committee. So just for you guys all to know, it's not just us within our organization, but we have 30 different members from the leading national child care associations and organizations that very much advise this work. And Tara Summers, actually from ATSDR, has been on that National Advisory Committee for several years. Next slide. So these are the different topics that we cover. On the left-hand side, you're going to see what we consider to be our core content areas. It's always difficult with this job because we feel that all of it's very important and we're following the research, but at the same time, as you might imagine, and as you're probably experiencing, a lot of this information is overwhelming for these professionals. On the right-hand side is what we consider to be kind of our additional information, and highlighted in blue is safe citing, and that's because one of our objectives for this year will be to create some easily understandable, printable resources that talk about the Choose Safe Places work. So we will be directing people back to the guidance manual and all of the materials that have already been created by ATSDR, but what we want to do is highlight within our program for everyone who's already familiar with eco-healthy childcare the importance of safe citing and what they can be doing and who they can be reaching out to, and ultimately directing them back to you all. Next slide. So I just want to go over here kind of some bigger arching things that we've done with this program. So besides working directly with child care professionals, what we're trying to do is do work behind the scenes to change what the best practices are in general for early care and education. So several years ago, what we did is partner with the National Health and Safety, the National Resource Center for Health and Safety in Child Care and Early Education. And for those of you who aren't aware, ultimately this is a group that is putting forth best practice recommendations for the full gamut of health and safety and early care and education. So these standards are not mandated, but why they're important is that when states decide that they want to update their child care licensing regulations or their quality rating improvement system regulations, they're very often going to these standards to discern kind of what is the best practice, what are the pediatricians saying, what are the experts saying in their field. And so several years ago, we worked with them to create this green resource on your slide here, Caring for Our Children, Environmental Health and Early Care and Education. And that's a compilation of all the standards that pertain to environmental health. We helped them just pull those all out and put them in one resource and then also update them. Some of the exciting news that we'll share in year 2 for this work is that we are going to be working with them to update the standard 5.1.1.5 that has to do with environmental audits. And so Tara is going to take the lead in actually rewriting that to be very reflective of the best practices that are being promoted through Choose Safe Places. And then in addition to that, what we're going to do is go through and look at all of the environmental health standards that could easily pertain or relate to safe citing, and then also refer folks back to these Choose Safe Places guidance best practices, which is huge because ultimately it's giving, I think, greater notoriety and just acknowledgement, I think, in the field of early care and education to the fact that Choose Safe Places is important and it's something that people need to be thinking about. Next slide. So these are some of our other key partners on the national level. So the National Association for Regulatory Administration, we work with them very closely because one of the entities that they support are child care licensing folks in all 50 states. So they're not regulating all 50 states, but they are kind of a touch point and a support system for those licensing staff. And so their executive director, for example, is on our Eco-Healthy Childcare National Advisory Committee. We present at their conferences, and we're very much relating to them any kind of information that we think is most important for their licensing staff to understand. And in your work, you've probably found that you can talk to direct service providers, but if you find that the licensing staff aren't on board, that is later going to become a hiccup because they don't yet know the information. So for us, for seamlessness, we're trying to make sure that licensing staff are always aware of these environmental health best practices. Additionally, we're working with Child Care Aware of America. That was one of the entities that spoke on one of our bi-monthly webinars last year in year one. And ultimately, they are kind of the hub for all of the different child care resource and referral agencies and networks around the country. So in each state, you'll have a network, and depending on how large a city is, you'll have a child care resource and referral agency. And so, for example, because San Francisco is large, they have 2 within just the city of San Francisco. The reason that they're important is because they very much have their finger on the pulse of what's going on with child care providers, whether they be family child care or center-based, early Head Start or Head Start. Next slide. So some of the work that we've also done is work with 2 of the leading national accreditation entities for early learning professionals. One of them is the National Association for the Education of Young Children, that's NACCHO on the right-hand side, and then the other one is the Association for Early Learning Leaders. The reason these 2 are important for your work is because they set national accreditation standards that pertain to center-based child care professionals. And so what we've done with both of them is go through their existing standards and help them update their environmental health related indicators so that they're more comprehensively protective of young children. NACCHO released their updated standards, I believe it was in April of 2017, and the Association for Early Learning Leaders has not yet released their updated version, but we have already kind of done all that work and we're just waiting for the release. Next slide. So what can you expect from us in year 2? A lot of it is similar from year 1. We're going to try to do these bi-monthly conference calls where not only are we asking for your participation to highlight successes that you've had or maybe challenges that we can all learn from, but we're also going to be bringing in entities to speak that you want to hear from. So we'll be going around and trying to figure out what is the key target individual or organization that would be most informational for you in this period of year 2. We will be creating new safe sighting educational materials from Eco-Healthy Childcare. So again, not reinventing the wheel, but just trying to create some simple, easy-to-use handouts, whether they be a fact sheet or frequently asked questions, that will turn and push people back to ATSDR and the guidance manual, and also educating them about the fact that 25 states are funded under this work, and hopefully those would be good context for them. We will also, as I said, be working with the National Resource Center to update their Caring for Our Children standard pertaining to environmental audits. And again, that's 5.1.15 if you want to look it up online to see where it's at right now. We will be actually conducting a training in Colorado, working with Megan Snow at the Colorado Department of Public Health and the Environment. So we're going to be conducting our 5-hour Train the Trainer course. It's happening in March. And the exciting thing about that is we're going to just shift things around a little bit so that the last 20 minutes or half hour is pertaining specifically to safe sighting. So the idea is that we will give people kind of that base knowledge understanding of what is environmental health, what are children's vulnerabilities, why is this important, and then bring in specifically what Colorado is doing around this Choose Safe Places work. So that people are all involved in hearing about this information at the same time. The audience for that will be higher level child care professionals is kind of how I coin it, but it'll be trainers, child care licensing staff, folks from the health department, and also health consultants. We have the access to the e-learning course if you're finding that you want to give people kind of a quick run through of understanding the basis of environmental health as it pertains to child care. We are going to be co-submitting to several conferences coming up on the national level. We've already been accepted at NEHA, and this will be a joint presentation with ATSDR, Children's Environmental Health Network, and NACCHO. And we also plan to apply to the National Association for the Education of Young Children Professional Development Institute, APHA, and NARA, again, is the National Association for Regulatory Administration. Finally, we'll be synthesizing the success stories from year 2. Next slide. Okay, so this, I don't have time to get into it because I'm realizing the time is running short here, but ultimately this is what we talked about last time in trying to understand the landscape within your state. How do you understand who are the leading individuals or organizations to make things happen? So when you refer back to this slide, these are the types of things that we're happy to support you with through Eco-Healthy Childcare in understanding what role do these entities play within your state and how might they be important. And something that we suggested last year was considering to make your own advisory committee within your state so that you can make sure all of these leading key thought leaders are coming in together to help you with the development of your program or project within your specific state. Next slide. So again, just a reminder, the tools that you can use right away right now when you are going around and engaging with different folks in your state is the e-learning course. And again, that's recognized in 48 different states for adult learning clock hours. We have 16 different fact sheets and again about 19 to 20 different frequently asked questions that are all free and downloadable. And again, these are just quick things that you can do when questions arise that don't really pertain to safe siting, but they do talk, people are going to naturally have questions about environmental health and, how do we decide what furniture we're going to use, or how do we know that it's important to use cold water when we're making baby formula. These are all going to be your kind of quick resources to go to so that you can really focus your work on safe siting. Next slide. So this is the contact information for both myself and Kathy, and we are happy to support you as you have questions. I'm going to hand it over now to Tiara Smith, and she's the program analyst within the Environmental Health Division at the National Association of County and City Health Officials.
Hello. As she just mentioned, my name is Tiara Smith, and I'm a program analyst here at NACCHO, which is the National Association of County and City Health Officials. For those of you who may not be familiar with NACCHO, we're a member organization comprised of nearly 3,000 local health departments across the U.S. We are an organization focused on being a leader, a partner, a catalyst, and mostly a voice for change for local health departments. So just a brief background. So our values include these items listed: equity, participation, excellence, integrity, respect, science, leadership, and innovation. And our work mainly focuses on the pillars listed. We're really big on advocacy for local health departments on Capitol Hill, and we communicate to lawmakers the vital role that local health departments have in protecting the health of communities. We also cultivate and optimize partnerships that are important for advancing local public health. We support effective local public health practice and systems through funding, technical assistance, and training. We host educational conferences such as NACCHO Annual and the Preparedness Summit, and we develop timely tools, resources, and publications. There are a number of ways to get involved with the NACCHO. Some of those ways include joining the Congressional Action Network, applying for an award. We have a program called Model Practices where we highlight the work of local health departments. Attend one of our conferences. As I mentioned, we have NACCHO Annual, which occurs in July, and we also have the Preparedness Summit. And we also have a newer conference called the Informatics Conference. And finally, a great way to be involved with NACCHO is to serve on one of our advisory groups or committees. We have numerous advisory groups on various topics, and it's a great way to have your voice heard at the national level. So we act as the voice of local health departments, as I mentioned before. So our role with CSP is to provide that local perspective and any information regarding local health departments. Last project year, we conducted interviews with local health departments. And those interviews were to determine what roles local health departments have in citing early childhood education centers to prevent children's exposure to environmental hazards. The assessment helped us to learn what the challenges, strategies, and resources related to local health department involvement in the licensing and regulation of ECE centers are. We were also able to identify best practices and technical assistance needs of state programs so that guidance, tools, and resources reflect what health departments experience at the state level. This year, one of the main things that we're planning is small group discussions. So these will involve funded state health departments and State Association of County and City Health Officials, also known as SACHOs. And on these small group discussions, it'll just be a sharing of information about the Apple Tree Grantee Program between the state and local health departments. And that is all that I have. Here is my contact information, and I've also listed more information about what we do here at NACCHO. Here are some of our environmental health policy statements that relate to CSP. Also, there's a link there to 2 of our environmental health blogs and our environmental health webpage. Thank you.
Great, thank you. So now we're going to hand it over to Toby Bernstein. She was part of Project Year 1 too. She's a senior attorney, the director of Indoor Environments and Green Buildings program at the Environmental Law Institute.
Hi there, can you hear me?
Yes, we can.
Great. Hi everyone. For those who are new to these calls, or as a reminder to others, ELI is a nonprofit research and education center. We're located in Washington, D.C., and we will be celebrating our 50th anniversary next year. Our mission, generally speaking, is to strengthen environmental protection by improving law and governance worldwide. We have many different programs. As Hester mentioned, I manage our Indoor Environments and Green Buildings program, which mainly focuses on providing research and analysis to help advance state and local policies and programs and focus on reducing indoor environmental exposures. In recent years, we've written a few policy reports specifically on environmental health and child care facilities. They're up on the slide. The first report was the one in January 2015, one that we looked at 10 different environmental health issues, and we reviewed state policies across the country, all 50 states. And one chapter in that report was on siting. A little later that year, we did a paper on drinking water quality policies because that subject was not covered in the initial report, and that paper was supported by ATSDR. And then just this year, we did a paper specifically as part of this project on environmental site hazards, which expands and updates the information we produced in the 2015 report to give an overview of state laws, state regulations, programs that specifically address environmental site contaminants. The next slide has the website at the top where you can get those reports. That's the main Indoor Environments and Green Buildings program website. It's a little hard to see the picture there, but we do list our publications by topics, and schools and child care will take you to those reports. You can also find on this program page a lot of other information relating to indoor environmental quality and state policies. And then on the eli.org website more generally, there may be information that could be useful to you in other work you're doing, other programs that we're involved in. Coming up in year 2, we're excited and looking forward to continuing the work on Choose Safe Places. There'll be 2 main areas of activity for ELI. First, we'll be continuing to support states with information about state policies that relate to safe siting. So we'll be watching for new policies, and we'll share updates as we become aware of things. If you have questions relating to state policies in this area, you can bring those to these bi-monthly calls. And if I don't have an answer right then, I'll get back to the group. And I'm also available and very happy to talk with any state program that is considering possible program changes, policy changes. If you have questions, if you're looking for information that might be able to assist your process, that might relate to what other states have done in their policies, you can certainly get in touch with me, and I'd be happy to set up a call to talk with you more specifically about the things that you're considering or what different models and options you might want to think about in trying to connect you to information that we have. My contact information is at the bottom of the screen. You can just send me an email, and I'll get back to you, and we can arrange time to talk. We're also going to be developing new materials in the coming months on the subject of funding programs for site assessment and remediation at child care facilities. One concern in developing these initiatives is the cost of conducting site assessment and any needed remediation. So we're going to be looking into the different types of programs that currently are available for these activities or that potentially could be used, and putting what we find into written materials that we're going to share with you. And then finally, as we get started on that work, I'd be very interested in speaking with any states that have been grappling with this issue of funding and cost to get a sense of what you think are the key needs and what type of information would be most useful to you, and just generally to understand what resources there may be available that you know of in your own states. So if you are interested in having that kind of a conversation at some point in the next several weeks, you can send me an email. Or right now, if you know you would like to talk about that, please feel free to use the chat feature on the webinar platform, and you can just send a chat saying, I'm interested in talking about funding, and then I'll make note of that and I'll get back in touch with you. And that's it for me.
Great. Any questions for Toby before we move on? All right. So I'd like to introduce, you guys probably know her already, but Deeza Patel is the health educator from the Bureau of Environmental and Occupational Health at the Wisconsin Department of Health Services, and she's just going to be one of our 2 states today that gives us kind of an update on strategies that they're doing within their state to move this work forward. Thank you.
Thanks. So I'm here to talk through what Wisconsin's doing, working with new and existing providers. So move to the next slide. We'll talk through first what we're doing with new providers. So we're following the Connecticut SAFER model like I think a lot of states are. And so we've connected with our Department of Children and Families, and they sent out these inquiry packets to all new licensed family and group child care centers. So these are centers that serve 4 or more kids. Some of them are in-home, some of them are in centers. So all new applicants will receive this brochure. It's 4 pages. It covers the 4 key elements of safe child care siting, taking a lot of information that ATSDR provided. And the next slide shows then our form that we actually have filled for people to fill in as a voluntary checklist. Both of these documents are available online or in the form itself, so people can mail or fill it out online and email it to us, whatever is easiest for them. We also have uploaded both of these into the ATSDR SharePoint site for sharing. And then the next slide will go into kind of the more unique thing that we're doing. So we had some carryover funding, and what we decided to do with that for our one-time activities moving forward is to fund local health departments. So we sent out a request, got 4 applications, and so we have contracted with 3 local health departments and 1 tribal agency. And so you can see how it's spread across Wisconsin. We're funding them. And the next slide goes into a little bit more of what activities they're doing. So we really just asked them to fill an objective of educating on environmental health issues, providing some information for them. So many of them are going to be reaching out to all the centers in their county or in their several counties. Some of them will be doing some specific assessments. Some will be providing either free or reduced water test kits for those private wells, conducting outreach on that and education, or partnering with like our asthma coalition across the state helps with the asthma walkthroughs to help reduce those environmental triggers and increase the indoor air quality. So one of the great things that's Kathy and Hester with EcoHealthy has been awesome working with, because they are way quicker than we are here at the state, and so they are actually going to be able to help us with getting kind of these block stuff for the e-learning courses. So the local health department will be able to provide some links for the providers so that they can actually promote that EcoHealthy e-learning course and the course credit that comes with that. So the next slide goes through kind of our timeline with this. So we have our new provider stuff is going to actually kick off in January. That will start in the inquiry packet. We're going to do a 6-month pilot project with that. Our webpage is in our approval process and is supposed to be due by January. It was supposed to be due, I think, probably 3 weeks ago, but by January. The existing stuff is currently happening, and their due date is March 31st. So because it's carryover funding, we actually only able to give them 4 months with getting everything through. So it's actually been kind of crazy going through with all the internal process we have, working with the local health departments. But we have been able to provide them with some draft social media messages, some links to our specific resources, to the Children's Environmental Health Network resources, to the Department of Children and Families resources. We also have a PowerPoint presentation template that we sent out and a draft template fact sheet that they can use. All of those things I uploaded into the ATSDR SharePoint site as well. So that kind of covers really high level nutshell what we're doing here in Wisconsin. So just want to thank you. The next slide has my contact information along with Claire Jones, my colleague here, toxicologist, who really is working with that new providers fact sheet. So thank you.
Great. Thank you, Deesa. Does anyone have any questions or ideas? Okay. All right. Let's move on then. So now we're going to have Melissa Dorowski. I hope I'm pronouncing that correctly. She's a public health specialist at the Bureau of Environmental Exposure Investigation in the New York State Department of Health.
Good afternoon. Can everyone hear me?
Yes.
Yes, we can.
Great. Thank you. So in New York State, the main licensing agency for early care and education is the New York State Office of Children and Family Services, which I will refer to as OCFS. And so as part of an application process to become a daycare provider in New York State, the regulations require that an applicant complete an environmental hazard evaluation guide. The applicant is responsible for reporting any potential environmental hazards that may exist on either the daycare site or the surrounding area. And such hazards include, but are not limited to, dry cleaners, gas stations, properties designated as Superfund sites, or properties with known contaminated groundwater. The application process also requires that an applicant complete radon testing in areas of New York State that are known to have elevated levels of radon. The New York State Department of Health offers self-testing radon test kit canisters to daycare providers at a reduced cost of roughly $550. So the results of those radon test kits that are reported to OCFS are required to be reported to OCFS, and if the daycare program is located in one of the high radon areas, they also have to submit the results. If the results of the radon test are above 4 picocuries per liter, remediation is required. So as part of this Choose Safe Places for Early Care and Education project, we are partnered with OCFS and we meet on a routine basis with them. However, recently our Department of Health radiation specialists took part in one of those routine meetings and they presented some information on radon. The meeting was extremely successful in capturing immediate feedback from our partner, OCFS, and implementing measures that were completed just a week later from that date. So overall, DOH and OCFS are going to work together with respect to training. We'd like to train both daycare licensors and or inspectors. We're also evaluating how to train the daycare providers themselves with respect to radon. We will also be assisting OCFS with data evaluation, so evaluating the radon test results, as well as helping to provide recommendations and or implementation of those recommendations, such as subslab depressurization installs and post-mitigation testing. Both agencies have discussed the possibility of recommending radon testing at all daycare locations throughout the entire state instead of the high radon areas that are denoted. In addition, it was found that there are approximately 45 other towns, villages, and or cities that are now found to be located within a high radon area. And the main reason behind that is the OCFS was using a list that was generated some time ago. So we took a look at that list. took a look at what we know about radon levels in New York State and found out that there should be about another 45 locations where radon testing should occur within the daycare provider location. So OCFS graciously agreed to update that list of high radon locations immediately. So moving forward, any new daycare provider locations or daycare applications will be evaluated with respect to those high radon areas. In addition, DOH offers, as I mentioned before, low-cost test kits for the daycare providers. And what we learned in our experience was that roughly only about 20 test kits were requested or ordered through DOH from a daycare provider perspective each year. And that seemed a little low to us. And what we found out was perhaps the main reason was a lag in our contract laboratory sending those test kits to the providers. In some cases, it took up to 6 weeks. So to address this issue, the Department of Health, the radiation folks, have agreed to change their procedures, and they will be mailing the test kits that the daycare providers request directly to the daycare providers within at least a few days to a week at most to expedite the overall sampling process. Now, OCFS is going to help by adding all of this information to their website. So if a daycare provider goes to the OCF webpage to find out what their requirements are for testing, they will find a link to the Department of Health's test kit order form, and will denote that we offer a lower test kit cost. Lastly, the Department of Health offers free post-mitigation radon test kits to residents of New York State, regardless of whether or not you're a daycare provider. And to promote the practice of ensuring that post-mitigation testing is done after a radon system or subslab depressurization system is installed, OCFS is going to, again, put information up on their webpage for the daycare providers and provide a link to our DOH test kit order form. And they're going to encourage that the daycare providers use this testing to ensure that the radon system is operating effectively at reducing exposure. So in having more of the test kits being ordered from the Department of Health, we'll be able to take a closer look at the radon results overall to ensure that the sampling is done appropriately and that appropriate actions are taken to reduce exposure. So that is it in a brief summary. I'd be happy to entertain any questions or comments. And my contact information is on the screen. You can certainly follow up with me at any time after this. And we thank you for the opportunity to talk.
Thank you, Melissa. This is Hester Paul again from Children's Environmental Health Network. Could you just speak to whether or not it was many discussions of bringing everyone on board from the two organizations or agencies, or was it a pretty easy discussion? I'm sorry if I wasn't quite clear. So the radiation folks, that was their first time directly speaking with OCFS. Whereas myself and my other colleague, Eamon O'Neill, we meet on a bi-monthly basis. But, bringing the radon folks on was that was our first time, and we had immediate success within just that 1 hour. Wow, that's remarkable. Thank you. You're welcome. All right. Are there any other questions, or we'd like to open it up, as Kathy said in the very beginning, to ideas or thoughts that you have for what you would like discussed or presenters for the next webinar? And at this point, too, I'm happy to hand it back to Jen and Tara if you guys have anything else you'd like to say to close.
And this is Kathy. Just quickly, if you do have a question, you can use the chat box, or to unmute yourself and ask a question over the phone, you can hit *7 to unmute if you'd rather use the phone to ask a question. Thanks.
This is Tara. Can you hear me?
Yes. Yes.
I just want to say thank you for everyone for participating in today's call, and a special thank you to our states who agreed to step forward and provide information on work that's going on in their states, and we hope moving forward we can continue to highlight work that states are doing, because I think it's really important to get good progress out there, and also to foster discussion and maybe ideas for states as we move forward. So thank you, everybody.
Thank you. So we're going to close the webinar. This is recorded, and so we will share the recording very soon. It might be next week, but we look forward to you guys sharing it again with any partners that you have within your states that you think it might be helpful. Thank you very much.